In this course, Radiology 101, we will be learning about the history and the different modalities associated with radiology. Radiology technology is the science that uses medical imaging to diagnose and sometimes and also treat diseases within the body. Radiographs are produced by transmitting x-rays through a patient. The x-rays are projected through the body onto a detector. An image is formed based on the rays that pass through versus the rays that are absorbed or scattered in the patient and thus are not detected. William Rankin discovered x-rays on November 8th, 1895 and received the first Nobel Prize in Physics for their discovery in 1901. As you can see here, the different diagnostic imaging modalities are radiologic technology, mammography, computed tomography, also known as CAT scan, ultrasound, interventional radiology, nuclear medicine, radiation therapy, and magnetic resonance imaging. What are x-rays used for? X-rays are used for a number of things. Our biggest culprit of x-rays are fractures. In most cases, fractures and infections in the bone and the teeth show up clearly on x-rays, followed by arthritis, dental decay, osteoporosis, and bone cancer. In this image, this is a typical x-ray room and a radiologist reading room. This next image shows our bread and butter of x-ray or radiology is a chest x-ray. There are two images here. The image on the left is a normal chest x-ray. The image on the right is, as you can see, a mass in the right lung. There isn't a huge distinction between the two. And although in radiology as x-ray techs, we're not diagnosing, we still do need to be able to realize that there's a pathology there and maybe it should be brought to somebody's attention. And if our images are not positioned correctly or we don't use the correct technique or we're not giving good, clear instructions for our patients to take a deep breath, we can make it look like there's something there that really isn't. So it's important for the x-ray techs to realize that they're responsible for the quality of images. Another reason we do a lot of x-rays for foreign body, especially in pediatrics. Pediatric patients like to put things in their mouths and swallow things. So on the image on the left, you'll see a jack that the patient has swallowed. And then on the right, although this isn't a pediatric arm, this is very much a pediatric fracture. It's usually used when the children or patient falls forward and the force and the weight of their body breaks the bone. Another subset to radiology or diagnostic imaging is mammography. Mammography is the imaging of breast tissue. It is one of the busiest radiologic modalities, and it plays a huge part in the prevention of breast cancer. And then computed tomography, also known as CAT scan. This imaging modality is used to scan the entire body, and then we are able to slice up the body into different planes: coronal, sagittal, axial. As you can see in the images on the right, I've reconstructed the images to make a 3D picture of the person's face and neck. And then on the image on the left, you're able to see that the imaging of the body you can actually slice through the body as if it were sliced bread, and then pull out a slice of bread, and you can see what organs sit in that part of the body. Ultrasound imaging, although many think It is just for babies. Ultrasound imaging does not use radiation. It's actually sound waves that hit the different structures of the abdomen or of the vascular system and then produce an image. Ultrasound imaging can be used for heart imaging. It can be used for OBGYN imaging. It can be used for cardiovascular imaging, abdominal imaging. They do biopsies with this imaging. And all it is just sound waves being sent through the body at a very fast speed. Another imaging modality is interventional radiology. This type of radiology actually goes inside of the vessels of its patients, and then we can highlight them with contrast. Contrast is a type of fluid that we inject into an IV or actually directly into the artery or vein and check for the patency of it. It's done in, all this type of imaging is done in a sterile environment. And it, as you can see on the images on the right, those are actually, the first picture is the renal arteries, and you can actually see the kidneys coming off of it. And images 2 and 3 on the images on the right are the checking of patency of different arteries in the patient. Nuclear medicine is most definitely radiation that we use to acquire the image, but it's radioactivity. Each type of nuclear medicine exam has a different type of radioisotope that we use that has an affinity for the part of the body that we're looking at. The images here are a bone scan, so all of the radioactivity is bound to a calcium-based pharmaceutical, and we inject the patient. We have them wait 3 hours, and then they come back for pictures, and we can see where the bone is being broken down or rebuilt. This type of imaging is used for cancer metastasis or to confirm or deny a stress fracture. And then we have radiation therapy. Radiation therapy, again, uses radiation not to acquire imaging, but to help in the treatment of certain cancers. The radiation is a pencil tip size beam that is directed towards a certain part of the body where the cancer or tumor is growing, and the radiation actually helps to kill the cells of the cancer. And lastly, we have magnetic resonance imaging, or MRI. This type of imaging is not radiation based. It's actually a magnet. And the machine, or the MRI machine, gives off very loud sounding frequencies that disrupts the atoms of the body, and the magnet realigns those ions in the body, and that's how we get our images. Magnets range anywhere from a 1T or 1 Tesla to a 5. The bigger the number, the faster the imaging. Most hospitals have about 3T imaging. And MRIs are really good at looking at soft tissue, ligaments, tendons. So it's used a lot for shoulder, back injuries, brain injuries. And that's about it. I hope you enjoyed the presentation.